Let me ask you something. What if the single most powerful thing you could do to cut your cancer risk after the age of 50 had absolutely nothing to do with expensive screenings, complicated supplement stacks, or any of the interventions your doctor has probably already recommended? What if it wasn't a medication, a procedure, or something that required a prescription? But one habit so quietly effective that the majority of people in their 50s, 60s, and 70s are still not doing it. What if it was something so deceptively ordinary that most people discount it entirely? Not because it doesn't work, but because it doesn't look impressive enough to be real. And what if skipping it, year after year, is one of the most consequential things a person over 50 can do to their long-term health without ever realizing it? And what if the research supporting this has been accumulating in peer-reviewed oncology journals for over a decade, not as a fringe theory, but as one of the most consistently replicated findings in cancer prevention science? Stay with me, because in the next several minutes, I'm going to walk you through the science behind this habit, the studies that quantify exactly what it does to your cancer risk, and a practical framework for making it part of your daily life starting today. And I genuinely believe that by the time we're done, you'll see your own body's potential very differently. My name is Dr. Ivy Ellington. I'm a certified radiologist, and what that means in practical terms is that I've spent the better part of my career looking at what cancer actually looks like inside the human body, where it starts, how it grows, and in far too many cases, how far it has already traveled by the time it shows up on a scan. Radiology puts you at a very particular vantage point in medicine. You are often the first person to see what no one wanted to find. And after years of reading those images, studying those patterns, and following the research on what drives cancer development at the cellular level, particularly after the age of 50, I became convinced that the most important work isn't happening in the imaging suite. It's happening years earlier in the daily habits that either feed this process or interrupt it. Over 2 decades in this field, I've sat across from thousands of patients in that moment, the one where everything they assumed about their future gets quietly rearranged. I've delivered news that no physician wants to deliver and watch people absorb it in real time. And I'll tell you what changes you in this profession after enough of those conversations. It isn't the complexity of the science, it's the pattern you start to recognize. Because a striking number of the patients who walk through my door with a new diagnosis share something in common. Not genetics, not geography, not random misfortune. They share years of chronic low-grade physiological stress that their bodies were never given the tools to resolve. And the question I kept coming back to, the one that eventually shaped everything I do now, was this: how many of these cases could have looked different if we had intervened earlier? Not with medication, not with a clinical trial, but with the right daily habit, applied consistently at the right stage of life. That question is why I'm here today. Now, I want to talk about something that comes up in almost every serious conversation about cancer risk after 50. And it's a word most people think they already understand: inflammation. Before you switch off on that word, stay with me, because what most people picture when they hear it is not what I'm talking about. The inflammation you're familiar with is the kind you can see and feel. You roll your ankle, it swells. You get a throat infection. It's red and raw. Your body rushes blood and immune resources to the site, fights off the threat, repairs the tissue, and then it stops. That kind of inflammation is not your enemy. It is one of the most elegant defense systems in human biology, doing exactly what it was designed to do. But there is a second kind of inflammation that operates nothing like that. It produces no visible swelling. It causes no obvious pain. It does not announce itself in any way you can feel or measure without a blood test. It simply runs, quietly, continuously, beneath the surface, year after year. And from what I see in my imaging work, day after day, it is one of the most destructive forces operating inside the human body after the age of, we call it, chronic low-grade inflammation. And if you want to understand what happens to the body after 50 at a biological level, this is the term you need to know. Scientists have even given the age-related version of this process its own name, inflammaging. It is a combination of the words inflammation and aging. And it describes something that is now one of the most actively studied phenomena in cancer biology. As we get older, the immune system undergoes a fundamental shift. It begins producing higher levels of inflammatory signaling molecules called cytokines, and it becomes progressively less efficient at switching that inflammatory response off once it is triggered. What that means in plain terms is this: the older you get, the more likely your body is to be running a low-level inflammatory state at baseline, and the harder it becomes for your body to correct it on its own. And unlike the acute inflammation we just talked about, this kind does not resolve with rest or time. It compounds. Let me give you the numbers, because this is where the picture becomes impossible to ignore. On a landmark study published in the journal Nature Reviews Cancer, established that chronic inflammation is a direct contributing factor in approximately 25% of all cancer cases worldwide. Not a correlation, a contributing mechanism, or 1 in 4 cancers, driven at least in part by the same chronic inflammatory environment we are talking about right now. A separate major analysis tracking the long-term health outcomes of over 100,000 adults found that individuals with persistently elevated levels of a specific inflammatory marker, C-reactive protein, or CRP, showed significantly higher rates of colorectal, lung, and breast cancer across a 15-year follow-up period. Think about what that means. A marker that shows up on a routine blood panel, a number your doctor may have already seen, quietly predicting cancer risk years in advance. And this is not an isolated finding. A large meta-analysis, pooling data from multiple independent studies covering more than 1.5 million participants across several countries, found a consistent, dose-dependent relationship between chronic inflammatory burden and cancer incidence. The higher the inflammatory load, the higher the risk. And crucially, the relationship held regardless of genetic predisposition. In other words, the inflammatory environment in your body was a stronger predictor of cancer development than family history alone in several of the cohorts studied. That is not a small finding. That is a finding that should change the way every person over 50 thinks about what they do with their day. Here is the number I want you to hold in your mind: 1 in 2 men, 1 in 3 women. That is the lifetime probability of receiving a cancer diagnosis in the United States today. Not a worst-case scenario, a statistical baseline. And when you understand that chronic inflammation is a documented, measurable contributor to 1 in 4 of those cases that in many instances could have been modified by what a person did or didn't do in their 50s, the conversation about daily habits stops being optional. It becomes one of the most important conversations you can have. You are watching this video. That means you are already in the window where this information is still actionable. That window does not stay open indefinitely. So why does chronic inflammation create an environment where cancer can take hold? Here's the science simplified. And I want you to follow this carefully, because once you understand the mechanism, the habit I'm going to show you stops feeling like general wellness advice and starts feeling like a precise biological intervention. Your body's cells are dividing constantly, millions of times a day, all across your body. DNA is being copied, and for the most part, that process is extraordinarily accurate. But when chronic inflammation is present, it floods the cellular environment with chemically reactive molecules called free radicals. These free radicals collide with DNA strands during replication. They damage them. And when that damage isn't identified and repaired quickly enough, which becomes harder as we age, errors accumulate. Those errors are mutations, and mutations, compounding over time, are what I see on imaging when a scan comes back and the news is not what anyone in that room was hoping for. But the inflammatory process doesn't stop at DNA damage. It goes one step further. And this is the part that most people have never. Chronic inflammation also directly suppresses what are called natural killer cells, the immune cells whose entire and singular purpose is to move through your body, identify cells that have mutated or behaved abnormally, and eliminate them before they can establish themselves and multiply. Think of your natural killer cells as your body's internal quality control team. They are running a continuous audit, scanning for errors, flagging abnormalities, and removing anything that doesn't belong. In a healthy, low-inflammation environment, that team is sharp, fast, and effective. It catches most problems early before they become anything serious. But here is what surprises most people when I explain this. And it surprises them because it never gets discussed in a standard checkup. When your body is in a state of chronic inflammation, that quality control team is being systematically undermined. The inflammatory signaling molecules, those same cytokines we mentioned, interfere directly with natural killer cell activity. The surveillance slows, the audits become less thorough, and in that gap, in that window of reduced immune vigilance, is precisely where early-stage cancer cells find the conditions they need to survive. Now here is where this becomes specifically, urgently relevant to you, if you are watching this and you are over 50. After the age of 50, every biological process we have just described accelerates. Your body's natural drift toward a pro-inflammatory baseline becomes more pronounced. Your natural killer cell activity declines measurably. Your DNA repair enzymes become less efficient. And the lifestyle factors that your body could absorb and recover from in your 30s, the poor sleep, the sedentary periods, the processed food, the unmanaged stress, begin to have a compounding effect on your inflammatory load that they simply did not have before. The rules of the game change after 50. The margin for error narrows, and most people are still playing by the old rules, entirely unaware that the biological landscape beneath them has shifted. What worked before is not enough now. And the habit I am going to show you in a moment is specifically calibrated for this stage of life, not as general advice, but as a targeted response to exactly the biological changes we've just mapped out. So what is the habit? What is the single daily practice that the research consistently identifies as one of the most powerful modulators of chronic inflammatory load, accessible to virtually everyone, requiring no prescription, no specialist referral, and no equipment beyond what most people already own? It is something called consistent, moderate intensity physical movement. And before you close this video because you think you've heard this before, I need you to stay with me for 60 more seconds. Because what I am not talking about is the version of exercise advice you have heard 1,000 times and filed away without acting on. I am not talking about training for a race, overhauling your routine, or spending hours at a gym. And I'm talking about a specific duration, a specific intensity level, and a specific daily consistency, each of which triggers a measurable biochemical cascade inside your body that directly counteracts the inflammatory process we've spent the last several minutes mapping. The science behind why this works is not what most people expect. And that is exactly what I want to show you next. Let me show you what the research actually says. Because the numbers here are not what most people expect, and they are too significant to summarize loosely. A large meta-analysis published in the British Journal of Sports Medicine, pooling data from dozens of independent studies covering hundreds of thousands of participants, found that individuals who met the recommended guidelines for moderate physical activity had a 20 to 30% lower risk of developing colon cancer, a 20 to 30% lower risk of breast cancer, and significantly reduced risk of endometrial and lung cancers compared to people who were sedentary, 20 to 30%, with walking, with cycling, with swimming, with whatever form of moderate movement a person can sustain consistently, not a clinical trial drug, not a surgical intervention, a daily habit. And the American Cancer Society, in their most current guidelines, made a statement that stopped me the first time I read it. They identified physical inactivity as one of the most significant modifiable cancer risk factors available to us, second only to smoking and obesity in terms of its measurable impact on cancer incidence. Second only to smoking. I want you to sit with that for a moment, because the gap between how seriously we treat smoking as a cancer risk and how seriously most people treat physical inactivity is one of the most consequential disconnects in public health today. But why does moderate daily movement produce these outcomes at a biological level? This is the part that transforms this from general advice into something you can actually understand and act on with conviction. When you engage in moderate aerobic activity, and we are talking about 30 to 45 minutes of sustained effort, 5 to 7 days a week, at a pace where you can hold a conversation but feel your heart rate elevated, your muscles begin releasing compounds called myokines. These are signaling proteins, and their function is anti-inflammatory. They travel through your bloodstream and actively suppress the same cytokine activity that drives chronic inflammation. Exercise is, at a molecular level, one of the most potent anti-inflammatory interventions we have documented in human physiology. But it does not stop there. Consistent moderate movement also reduces circulating levels of insulin and insulin-like growth factor, IGF-1, both of which, when chronically elevated, create a hormonal environment that actively encourages cancer cell proliferation. It lowers cortisol, the primary stress hormone, which has its own direct relationship with immune suppression, and it improves the efficiency and response time of your natural killer cells, the same quality control team we discussed earlier, measurably restoring the immune surveillance function that chronic inflammation degrades. Each of these mechanisms is independently documented. Together, they describe a single daily habit producing a cascade of anti-cancer biological effects that no supplement on the market currently replicates. Now, I want to pause here because I know what some of you are thinking. You are thinking, Dr. Ellington, I already know I should exercise more. This is not new information. I have heard this my entire adult life. And you are right. The recommendation is not new. What I am asking you to consider is whether you have ever truly understood why, not at the level of exercise is good for you, but at the level of what is actually happening inside your body at a cellular and molecular level when you do it or when you don't. Because here is what changes when you understand the mechanism. You stop thinking of a 35-minute walk as something you do for your weight or your mood or your general sense of well-being. You start understanding it as a direct intervention against the specific biological process, chronic inflammatory dysregulation, that the research links to 1 in 4 cancers. That reframe matters. Because the people who treat this habit as optional are not making a neutral decision. They are making a decision about the internal environment their cells are living in every single day. When there is one more piece to this that I cannot leave out, and it is the one that my patients consistently underestimate, often because it does not feel like an active intervention. It feels like rest. I am talking about sleep, specifically the quality and duration of sleep after the age of 50. Here is what most people do not know about what happens inside their body while they are sleeping. Your DNA repair enzymes, the molecular machinery responsible for identifying and correcting replication errors before they become mutations, are most active during deep sleep. Your immune system consolidates its defenses during sleep, and your body clears metabolic waste products, including inflammatory debris, through a system called the glymphatic network, a biological clearance system that is only fully operational during sleep. When you are not sleeping enough, that clearance does not happen completely. The inflammatory load does not fully reset, and the repair work that should have happened overnight gets deferred, compounding the cumulative damage we have been talking about. The research on this is unambiguous. A study published in the Journal of the National Cancer Institute found a direct association between chronically shortened sleep, defined as consistently fewer than 6 hours per night, an increased risk of colorectal and breast cancer. 6 hours, that is the threshold. Below it, the biological cost becomes measurable in cancer risk terms. 6 to 8 hours of quality sleep is not a passive luxury. In cancer prevention terms, it is as active an intervention as anything else I have described today. Let me bring this together. After 50, your body drifts toward chronic inflammation. That environment damages DNA, suppresses immune surveillance, and creates the conditions cancer needs to take hold. But you have 3 evidence-based tools that address this at the root. First, 30 to 45 minutes of moderate daily movement to trigger myokine release, reduce hormonal cancer drivers, and restore immune function. Second, an anti-inflammatory dietary pattern. Colorful vegetables, olive oil, fatty fish, berries, legumes, whole grains. Reduce processed food, refined sugar, excess red meat. Third, 6 to 8 hours of quality sleep every night to complete the cellular repair your body cannot do while you are awake. None of this requires a prescription. None of it requires a specialist. When it requires understanding your biology well enough to give it what it actually needs at this stage of life. I have seen patients in their 60s and 70s make these 3 changes and watch their CRP levels, their circulating inflammatory markers, drop significantly within 3 months. Not years, 3 months. I have seen people walk into my office convinced that cancer was inevitable because of their family history leave, with a completely different understanding of how much agency they actually have. The biology is not fixed, the trajectory is not set, and the imaging I have seen from patients who made these changes consistently tells a very different story from those who did not. Your genes are not your destiny. Your daily environment, including the internal biochemical environment of your own body, is something you have far more control over than you may have been led to believe. That is not optimism. That is what the data shows. If this was valuable, do one thing right now. Hit the like button. It helps this content reach people who need it. Subscribe if you haven't, because I release new videos every week on evidence-based cancer prevention that your doctor may not have time to cover in a standard appointment. And if you know someone over 50 who needs to hear this, share it with them. The best thing you can do for the people you love is make sure they have access to the right information at the right time. I'm Dr. Ivy Ellington, certified radiologist and your guide to understanding what your body is doing and what you can do about it. I'll see you in the next video. Stay well.